Hello, Mr. Morrison and fellow kinesiology classmates. I will be discussing common sports injuries in my CPT video, as well as a brief overview of tendons, ligaments, joints, and bones, just to give everyone a better understanding of what they are and why they are important to the human body. So yeah, thanks. Keep watching. To start off the video, I will be giving a brief overlook and explanation of bones, ligaments, tendons, and joints. Movement and maintains posture. Muscles require chemical energy from the metabolism of food. In this image over here, it is an image of the gastrocnemius, which is located at the back of someone's calf, and then you can see the tibialis anterior, as well as the tibialis posterior, and the soleus. So, understanding a joint is a structure that separates two or more adjacent elements of the skeletal system. The motions that joints are responsible for include spinning, swinging, gliding, rolling, and approximation. It helps aid in smooth movement. So over here is an example of a knee joint. So you can see the patella, the articular cavity, the synovial membrane, the infrapatellar fat body, and the patellar ligaments, as well as the cartilage and the lateral meniscus. So now we are taking a look at what a bone is. So bones provide support for our bodies and help form our shape. It provides structure, stability, and shape as well, protecting vital organs as well as being the framework for our body. So over here is just a little skeleton with some of the more known bones, so the cranium, clavicle, ribs, radius, ulna, and metacarpals, all shaping our bodies and basically overall being the framework. Understanding what a ligament does. A ligament is a tough band of fibrous tissue that connects bone to bone or bone to cartilage. Ligaments are extremely strong. However, they can be stretched out or even torn, resulting in different grades of sprains. So over here is just a medial view of a foot. So as you can see, the different ligaments on the inside of someone's right foot, they're known as deltoid ligaments, and yeah. 4 common sports injuries that we will be talking about. The first injury is shin splints. So shin splints are stress put onto the shin bone and connective tissue that attaches muscle to bone. It gets inflamed and is very painful. It is known as the medial tibial stress syndrome because of where the pain originates and where most athletes or people that have shin splints experience it. What causes shin splints? Flat feet, shoes that don't fit well, working out without warm-up or cool-down stretches, and overall weak ankles, hips, or core muscles. Diagnosis of shin splints. How to diagnose shin splints? It's usually diagnosed by a physical exam or based off other medical history, as well as an x-ray may be used, but to differentiate between stress fractures or shin splints, an MRI or a bone scan will be necessary. A stress fracture will show wide signal problems, and shin splints will show linear signal problems. How are shin splints treated? So shin splints are usually treated with the Rice method, so rest your body because it does need time to heal. Ice your shin every 20 minutes on, 20 minutes off to reduce pain and swelling. Use insoles or orthotics in your shoes to help with the arch in your foot. Take anti-inflammatory painkillers if you need them, and then after you don't feel the pain anymore, maybe think about strengthening your lower leg muscles, a sports massage, training on softer surfaces, physical therapy, and always remember to wear the appropriate shoes that'll help support the arch on your foot. Injury is ankle sprain. So what is an ankle sprain? An injury that can occur when someone lands on their foot awkwardly and twists it. What is the purpose of ligaments in someone's ankle? Well, they are strong, stretchy bands that help stabilize your ankle while holding the bones of your ankle together, allowing for proper movement to occur. The picture on the right is an image of an inversion sprain happening, is when the toes move towards the medial part of your body, so your foot lands on the outside, which will cause damage to the lateral ligaments on the outside of your foot. How do ankle injuries happen? Well, they happen when the outside of the ankle, when you roll your foot, this causes the ligament on the lateral side of your ankle to stretch more than it is able to. What causes ankle injuries? Well, it happens when you're playing sports, especially when you're playing a game, when there's a lot of jumping or chance of stepping on someone's foot. Those sports include basketball, soccer, or volleyball, but it can happen in any sport. It is easy to sprain your ankle even by stepping off a curb the wrong way or taking a walk on the beach or walking up the stairs even. What will a person feel? Tenderness to the touch, swelling, bruising, itching, cold and numb feet, and stiffness. Also, you can start to see bruising and the color change. If you feel that you may have potentially torn your ligaments severely, you may feel a pop or even hear a noise when the injury has initially occurred. So, treatment for ankle injuries, such as like a first degree or first grade sprain, includes rest, ice, compression, and elevate. So, for rest, you don't want to be continuing your activity or sport with an ankle sprain because you don't want to risk further damaging it. With ice, you want to ice it between 20 minutes on and 20 minutes off to decrease the pain and swelling. Compression, wrapping your ankle in like a tensor bandage or even like an ankle brace, but I would definitely go check it out at the doctor before you decide to wrap it in anything. And elevate, so elevate to at least your heart level to increase blood flow and reduce swelling and pain. Don't put any weight on your ankle until after it's been evaluated by a doctor to rule out potential fractures. 3 different classifications or grades of ankle sprains, basically graded on the amount of damage occurred. So grade 1, you will feel sore and may slightly be swollen. In this case, the ligament is overstretched but not torn. In grade 2, there's a partial tear in the ligament. This causes prolonged pain and swelling, might prevent you from putting your full weight on your ankle. Noticeably bruising. The tear is causing bleeding under the skin. And then grade 3 is a full tear of the ankle ligament. May have heard a popping sound when it happened. Causes severe pain, swelling, and bruising. Because the ligament is no longer able to do its job, will feel very unstable and will be unable to support any of your weight. The next injury is an ACL tear. So what is an ACL? It's one of the 4 ligaments in the knee that provides stabilization to the knee joint, also known as the anterior cruciate ligament. Anterior meaning the front, so the front of someone's body, so the front of someone's knee, but obviously behind both the femur and then the tibia that are connecting. What causes an ACL tear? Well, a change of direction or pivot with a locked knee joint, usually non-contact, but it also occurs at low speeds, or a direct blow to the front of the knee when the foot is planted. An example of this may be a tackle in football or soccer. So if you look to the right, it's quite obvious that that is a normal ACL and that is a torn ACL. The damage is shown with more of like the white color from the scan. What symptoms can occur when an ACL is torn? So someone may hear a loud pop sound, then develop intense pain in the knee. This pain makes walking or weight bearing very difficult. The knee joint will begin to swell in a few hours because of the bleeding within the joint. This makes it difficult to straighten the knee. If left untreated, the knee will feel very unstable and the athlete may complain of reoccurring pain and swelling, especially when walking on uneven ground or even climbing up and down the steps. Treatment for an ACL tear: rest, ice, compression, and elevation. So you're resting, you're not playing your sport, you're not putting weight on it. Ice, you want to ice for 20 minutes on, 20 minutes off to reduce pain and swelling. Compression and elevation. And then you will be going into rehabilitation, so physical therapy. You'll be given exercises that will strengthen your injured ligaments. You may need to wear a brace and use crutches to avoid putting weight on it. The goal is to reduce pain and swelling and restore full range of motion and strengthen your muscles. However, surgery may be necessary if you're an athlete and want to continue in your sport, or if more than one ligament or the meniscus in your knee is also injured, or that the injury is causing your knee to buckle during everyday activities. So basically, a quick rundown of the surgery. The surgeon will remove the damaged ligament and replace it with a segment of a tendon or tissue similar to the ligament that connects muscle to bone. This replacement tissue is called a graft. So recovery time frame: there is no set time frame for when athletes can return to their sport. However, your doctor and physical therapist will perform tests and gauge the strength and progression of your knee. Can take 6 months up to a year or even more. This all depends if the athlete is putting in the proper amount of effort to heal their injury, and of course genetics and just overall how much effort the athlete will put into doing the exercises that they are given. Some symptoms that one can feel when a stress fracture on the foot has occurred. Well, some symptoms are not as obvious, like swelling, but symptoms can occur a bit differently in each person. Pain in the front of the foot, often after a long or intense exercise. The pain that goes away when an exercise is complete and then returns when exercise is continued. How is it diagnosed? A complete physical exam and health history workup. X-rays cannot pick up stress fractures because of how small they are, so a bone scan or an MRI must be done. But once calluses form around the stress fracture, that is when an X-ray can pick it up. Lastly, treatment. So it usually takes 6 to 8 weeks to heal. Treatment used to heal stress fractures and relieve pain. So rest, protection of the fracture site with reduced weight-bearing activities, cold packs, medicine like ibuprofen can be used, shock-absorbing shoes to use during exercise, running on soft surfaces such as grass, physical therapy, switching to a less stressful activity such as swimming or biking, and you may have to end up wearing a brace or a cast.